Today, we will talk about febrile seizures, a common condition that can be alarming for parents and caregivers. Febrile seizures occur in young children, usually between the ages of 6 months and 5 years, and can happen when a child has a rapid spike in body temperature, often due to a viral infection. These seizures can be frightening to witness, but it's crucial to understand what they are, how they occur, and how to manage them. Febrile seizures, which are sometimes referred to as febrile convulsions, can manifest as shaking, twitching, or stiffening of the arms and legs. In some cases, a child might lose consciousness. These seizures can last anywhere from a few seconds to 15 minutes, but most are brief, lasting less than 5 minutes. It's important to note that febrile seizures affect about 3 to 5% of children in the United States, and the incidence varies based on age and ethnicity. To clarify, febrile seizures are typically categorized into 2 types: simple and complex. Simple febrile seizures are brief, typically last under 15 minutes, and do not recur within a 24-hour period. In contrast, complex febrile seizures last longer than 15 minutes, may occur more than once in a 24-hour span, and can involve specific symptoms, such as focal onset. While febrile seizures can be distressing, the good news is that they are generally harmless and do not usually lead to long-term health issues or epilepsy. Now, why do these seizures happen? The exact mechanism remains somewhat unclear, but it is believed that the rapid change in temperature triggers an imbalance in the brain's electrical activity, resulting in a seizure. It's important to remember that febrile seizures are not caused by the fever itself but rather the fast rise in temperature. Most children will experience only one febrile seizure in their lifetime, but some may have them more than once, especially if they have a strong family history of febrile seizures. If your child has a febrile seizure, it is essential to stay calm. Remove any nearby objects that could potentially injure your child and gently position them on their side in a safe area. Avoid putting anything in your child's mouth, as this can lead to choking or injury. Timing the seizure is crucial. If it lasts longer than 5 minutes, it's time to seek immediate medical attention. After the seizure, your child may be disoriented or asleep, which is entirely normal. In terms of the underlying fever, treating it may help prevent future seizures. Medications such as acetaminophen or ibuprofen can help reduce fever but do not prevent the seizures themselves. If your child's fever is due to an infection, you should consult your healthcare provider for appropriate management. They may recommend further evaluation if the febrile seizures are frequent or atypical. While experts believe most children will outgrow febrile seizures, it's essential to keep an eye on other potential risk factors. Children with a family history of seizures are at a higher risk, and so are those with developmental delays. Fortunately, studies have shown most kids who have febrile seizures will not develop epilepsy. In fact, only a small percentage of children with febrile seizures go on to have unprovoked seizures later in life. To further ease your worry, it's helpful to understand that the prognosis for children who experience these seizures is very good. They do not usually experience cognitive or developmental impairments due to the seizures. Nevertheless, follow-up consultations with your pediatrician can help monitor your child's health and development when febrile seizures occur. In summary, febrile seizures are generally benign but can be distressing for parents. Awareness of signs, appropriate response, and supportive care can make a difference in managing the situation. If your child experiences a febrile seizure, while it may require immediate medical evaluation, rest assured that most children recover fully and lead healthy lives. Understanding is crucial in easing fears about this condition, so spread the word about febrile seizures to help others feel more prepared. Thank you for watching, and don't forget to subscribe for more informative content about health and child development.